What is going on, everybody? Today I am at Denver Sports Recovery. It's a state-of-the-art recovery facility here in Denver, Colorado. Anyone from elite athletes to weekend warriors can come here and utilize all of the awesome recovery tools that they have. And I'm gonna take you through a full tour of the entire facility and show you all of the amazing recovery tools that they have to offer. So let's get into it, come on.
I'm Dr. Morgan Dahlstrom. I'm a physical therapist here at Denver Sports Recovery.
Right.
I'm going to help you take through everything.
Let's go.
All right.
What do we got?
This is full body light therapy, so it's red light therapy. We also call it the light pod.
Okay.
It looks like a tanning bed. It is not a tanning bed. It's essentially just full body light therapy, like it says. It has a bunch of different settings on here, so you get in, you put it to sports recovery mode or skincare mode, and it's just a ton of red light therapy, which is awesome for wound healing, for recovery in general, for your muscles to recover. It's really good for skin, for anti-aging stuff. You want to heal, wounds that haven't had a hard time healing. Sometimes we put post-op patients in here too.
Okay.
So, ton of benefits on this thing. So many different settings in here too that you can work on, and honestly, it just feels really nice.
Would you recommend anybody get in this thing? Like, who specifically do you think would benefit most from this red light therapy?
Yes, I've used it a lot recently with people with like a lot of stress going on in general. They just have a ton of overall body inflammation, right? And I think that's the best thing, because we have 3 other versions of red light therapy that we can use, and those are like concentrated, right? So those are more like laser therapy. This will get the whole body, right? So in general, if you're just feeling more fatigued, more slump-like, more aches and pains all around, this is a good option for you.
Got it. Whoa! That was awesome.
It's pretty crazy, isn't it?
I think the sound got me. It was like, shoo. Okay, so you just lay in there.
You lay in there.
Is that like a clothed or unclothed?
I tend to tell people to go completely unclothed.
Okay.
The light's only going to heal when it's going to touch.
Oh, got it.
It's a pretty superficial one.
Got it.
Yes. We use these little eye protection glasses too for those ones. Yeah.
These things. Protect the eyes. Tanning bed style.
Yes.
And then you can do some pull-ups too if you just want to get a quick pump.
Yeah.
Solid. Okay, cool.
You can go without the eye protection, but some people just feel more comfortable with it too.
Okay, cool.
Yeah.
So what's next?
Next. So all of these rooms are all private treatment rooms. And then massage room in here.
Massage room.
We have all of our sports jerseys all around of the people that have been here, have been treated by some of our owners.
Okay.
Yeah, so all these
So
private treatment
massage.
rooms are massage or chiropractic or acupuncture.
Okay.
I think we have, let's see, like 6, 7, 8 of those in total.
Whoa, yeah,
Yes,
here.
yes, this is our private sauna.
Okay.
So this is the one that members use, or anyone you can use, but you reserve this one.
Okay.
So this is a single person, or if you're with another person, you can fit 2 in here, but single person sauna that you reserve for 30 or 45 minutes online or by calling the front office.
Let's open it.
Yeah.
I can already feel it.
Mm-hmm. And this one's an infrared one, so it doesn't get as hot. Yeah.
There you go. You just chill. I'm gonna show you. Can I sit?
Yeah.
Okay, I'm sitting in it, y'all. It's so dark still.
It's still dark.
Sitting in the sauna, it feels nice and warm. Oh god, I was so cold outside, so it's great. All right,
Feels great.
sauna.
Yeah.
Let's go.
And the infrared ones are usually like 140 to 160, where the hot saunas can be like 180, 190.
Okay.
Yeah.
All right. So we're cruising down the hallway.
Yeah. All of our sports jerseys. This one's a new one, new edition from CU.
I love it. A bunch of athletes come here.
Right?
More offices.
Yeah, and Cammie's the name of our acupuncturist. So this is the massage therapy room.
So acupuncture as well.
Yeah. And then we can head down this way.
Okay.
A couple bathrooms on the right side and showers in 2 of them. This one is our group sauna, or our public, not private sauna, right? So this one's no reservations. Up to 4 people can fit comfortably in here too. So just walk in, walk out as you please.
Okay. And the red light is for aesthetic, or is that a functioning red light therapy thing?
Functioning red light.
Okay.
Yeah. You can, yes.
How
So
does
that
this
you
thing
can
open
change.
up?
Yeah, either side.
Ooh. Again, okay. Oh yeah. Oh yeah.
There you go.
It's for groups, Morgan. Ooh.
Oh yeah.
What's the temp?
167.
167. All right.
47, 167.
Heck yeah.
Probably
You feel
hovering
warm?
between those. Very.
All right, look at this. This is pretty spacious.
We do up to 4
Okay.
recommended, but sometimes if there's groups, they fit a little bit more in.
Yeah.
Yeah.
I'm honestly just delaying because I'm cold, and now I feel warm.
So it feels nice.
All right. to the next.
Woo! This one is both a chiropractic treatment room and a massage therapy room, just depending on who's here that day.
Okay.
Yeah.
Nice.
Cool.
The journey continues.
Here we go.
My name is Junior Tafuna. Play football. I'm not a swimmer, so yeah, man, love coming here. Man, obviously got the cold and hot tub over here. That's one of probably the biggest things that I use specifically to get recovery. And then you honestly got everything from PTs and massages, everything you got that you can use to recover. So it's awesome.
So what's your favorite thing to use here?
It's honestly the outside cold tub, and then come here to the hot tub, and after that just getting cupping at anywhere where I got ills and ailments. So. You know, training for pro day, that's something that you know, us seniors will do after, you know, try to get a shot at the big leagues in NFL. Yeah. So we're just training for that, and then coming here is just allowed us to get our bodies back, get our bodies right, because you know when you a bunch of wear and tear from lifting and running. So yeah.
OG hot and cold tubs. This one's cold, this one's hot. A lot of people do contrast therapy up to 5 minutes in each for 3 rounds. Okay. Or you can just do the hot tub because it feels nice. Yeah. This one isn't our coldest one. Yeah, this one sits at like 56 degrees, where I believe the one outside is more close to 140 degrees.
Okay, so cold, hot.
Yes.
And people like to do contrast. Tell me a little bit more about the benefits of contrast therapy.
Contrast therapy is just really good at flushing out a lot of soreness, right? We do it a lot with subacute injuries, right? So let's say if you sprained an ankle and it's like maybe a week or so after, you still have a good amount of swelling, but you're out of that acute phase, so you don't need just ice at that point. We'll flush it in and out, so we try to get some blood flow back into it, new blood flow back into it, while still promoting cold to get some inflammation down and pain.
Got it.
Yeah.
So what about the contrast between people liking to do cold plunge sauna? How does that compare? Same concept?
Same thing. It's honestly just a preference thing. Yes, sauna tends to be, I mean, the hot tubs sit around like 101 to 104 degrees, and the sauna's obviously a lot more than that, but the sauna will be a little bit better at warming up your core. Right? Because this one tends to be a little bit more superficial. Sauna should get into like the deep core temperature in order to raise that. So there's been some research and studies that say that it's better to do a sauna, but nothing super conclusive about it too.
Well, let's talk about cold plunging in general, because it's such a big topic right now.
It is.
Not contrast, just purely cold plunge. What are your thoughts on that?
I have mixed opinions on it. Yes, to be honest with it. Just because I think if some people it goes back to the cortisol levels, right? So if some people are in constantly, you know, a heightened state.
Got it.
And they try to go cold plunge to help them, you know, fix some of these issues, I think it's going to exacerbate it, right? I think a lot of it has to be said on like the mental aspect of it, right? So I'm like, I think that's awesome for people who like just get a lot. I mean, we have clients here who will do it for 20 minutes a week, right? So try to do like at least 5 minutes a day, maybe 3 rounds.
No kidding.
So I think the mental aspect, the toughness, learning to breathe through that, calming yourself down, and then adapting yourself to cold. Awesome. Right. But I think a lot of people have mixed opinions, and I don't think the research backs it enough.
Fair enough. So most of it is a mental thing.
I think so.
Mental resilience, if you will. Okay. Cool. There we go. All right. So I found somebody here that is using a day pass. Let's ask him what he thinks about this.
Like somebody who works at a desk often, I got like, you know, all kinks in my back from working out and then being sedentary throughout the day. So like having the tub, the plunge, the sauna options, and all the other recovery equipment, it's like I don't have any of the stuff in my house. So it's awesome to just pop in when I'm not feeling great and then I'll be feeling better. So
then when you're here, you typically you're in the hot tub right now. What do you like to use the most?
Yeah, mostly the hydrotherapy, like the recovery center. So like between the hot tub, the plunge, and then the sauna. And then I've been looking at the, what are those compression like?
Yeah, the Normatec?
Yeah. I haven't used them yet, but they look great.
Let's keep cruising. This one is a unique recent addition. This one's called the Sigma Q tub, which is a brand, Sigma Q neurotherapy. So this one, it's not super hot. It's kind of like a warm, comfortable temperature of water.
It's a warm tub.
Yes, it's a warm tub, but it is used essentially as E-stim currents that go through sound waves in the water. So they're safe. They're not going to shock you. But it's used to activate different parts of your body.
So what do you feel in the water?
So you will literally just like sit in there and put it on certain settings and you will feel your quads start twitching.
Your quad will twitch?
Yep.
So there's literally like stim going through this in a safe way?
In a safe way,
So if I put my hand in, will I feel something?
No. Yep, because no settings are on right now.
Oh, got it.
Yeah,
So it's just like a nice warm bath.
Yes, but yes, if you did that and some settings were on, then you would feel a lot of muscle activation in that hand.
That's
yes,
wild.
It
And
is
so why would somebody want to get in this?
So Sigma Q is a relatively new thing. They would probably want to do it similar to like a muscle activation type therapy. A lot of times, like when some of the soft tissue stuff we do, we calm down the muscle a lot, and then it's not ready to fire.
Okay.
Right. So if you went and got like a deep tissue massage, you shouldn't compete right afterwards. Right.
Yeah.
If you do like a ton of dry needling, you shouldn't be in a competition right afterwards.
Yeah.
So sometimes with those modalities, activating your muscles right afterwards can be really helpful and help you feel a lot ready to function.
I see. Okay.
Yeah.
So who typically utilizes this thing the most?
Anyone? Yeah, I was like, a lot of our members do. I wouldn't say there's a specific type of person or athlete that uses it a lot. I think it's just more of a trial type thing because many people just don't know about it, right? So I think this just needs a little bit more exposure to all the sports realms. I know a lot of like professional sports teams have those in here right now too, but I think it's one of the up and coming things.
Okay,
so
I've never
basically you just try it. Yeah, right? And one of our staff members can take you through it. It's pretty cool.
Super cool. Check that out.
Right? All right, so on these ones, all of these treatment tables we use for E-stim, for Mark Pro, which is a pulsed TENS unit that gets the muscles going a little bit more. And then we use it for like the hip compression, the Normatec hip compressions, because you need to be a little bit more flat to do that rather than our chairs.
Got it.
Too.
Okay, so these tables here.
Yeah, so regular E-stims typically used for pain and inflammation. Part of the gate control theory, right?
Yeah.
Kind of distract your brain from that sensation of pain, and those effects last longer than just when the E-stim is on.
Okay.
The Mark Pro is a pulsed TENS unit, so we put those ones on your traps or on whatever, and it makes those muscles jump and makes you feel like you're dancing.
Yeah.
That one's just really good at flushing out muscle soreness.
Okay.
Yeah.
Right.
Here's where all of our Normatec gear is. So these are mostly, these ones are all leg compressions. We also have arm sleeve attachments and the hip compressions.
Okay.
Compression therapy is awesome for any kind of inflammation, right? A lot of endurance athletes love compression, right?
Yeah.
It feels really nice, right? It's just gonna help, basically it's gonna help pump out blood and then pump in new blood. So it improves your circulation with that too, and just helps overall recovery, increases blood flow.
Yeah.
Cool.
Can we hop in the boot?
Let's do it. Let's go. We're gonna hop in the boots. These you kind of just pull up like pants. So next leg, and then gotcha. Nice.
Okay. So it's either you get taller or
exactly, or it just comes out. This guy snaps right in here. Same thing here. Get it. There we go. These are the fancier new machines too.
Okay.
Select legs attachment, and the pressure levels go from 0 to 7. Right, so 7's the most intense. We'll start you at 4, see if you like it. And these ones you can turn on and off specific zones of them, which is really nice if we have someone that's like not gonna tolerate compression on a new injury. Normal time's about 30 minutes. And we'll just start you from there.
Let's just feel it.
It's so nice.
Just a lot of pressure coming in through. I slowly feel it creeping up my leg. It's quite nice. People that have there's memberships or one-time use, tell me about how you can come here and then what you have access to.
Yeah. So the most often used is the monthly memberships, and we have different levels of the memberships too. The basic membership gets you all the access. All the memberships get you access to here, and the basic membership is just that. Then we have silver and gold that have points with it too, which you can use to redeem for other services. So the day pass can also be an option too, which is $35, and that's one-time use. We also have punch cards, right? So lots of different options, but that gets you access to everything back here. So the cold tubs, the hot tubs, Sigma Q, everything on the tables, and then the Normatec boots, and some of the soft tissue tools and the Swiss swing too.
Okay.
We're always staffed with a recovery center specialist, right? So everything on those tables needs to be set up by a recovery center specialist, especially with the E-stim stuff. So you can always just flag one of us down and we'll get you set up on things too.
Range of athletes that comes here.
Oh my gosh,
what does that look like?
I mean, people who don't do any activities at all come here because a lot of that is chronic pain type stuff, right? So people who have, autoimmune diseases or things like that definitely can benefit from a lot of this stuff, especially red light therapy. So you don't, people who don't have to be active at all to come here, but we also have semi-pro and pro athletes come in here too, right? We've hosted a lot of teams, which is really cool, especially when teams are traveling, right? Nice. We've had a lot of professional sports teams come in, but the whole spectrum of athletes can come in here and everyone can benefit from it.
I'm out of the No Armor Sec boots. We are moving through this tour. Here we go.
So we're in the IV room, the nurse's room, the team physician room. They offer a ton of services, so much so that I'm gonna let Abby talk about it over here too.
Abby!
Hi! We offer a variety of IV and injectable services. Okay. One of our most popular things that we do is NAD. Okay. It's a coenzyme that supports a variety of chemical reactions in your body. Okay. Everyone loves it for like anti-aging, energy production, all that good stuff, so that's one of our most popular. Okay. And we have good recovery IVs for like after sports events or immunity if you're preparing to travel or anything like that.
Yeah. How popular has this become?
It's definitely gaining in popularity as people hear more about the services. And then NAD specifically has been talked about recently on a lot of podcasts, so we're definitely getting people in from those.
Got it. So is this an add-on to the membership? How does it work if somebody wants to do this?
Yeah, so with the DSR membership, they get some perks here in the IV clinic. It is a little bit of a separate add-on that people can get, but if people are DSR members, that can give them some money off and some good deals.
Okay, cool. So they come and they sit in the chair and they get the IV.
Yes.
Right on. All right, well thank you, Abby.
Yeah, of course.
Okay, so this is the rest of the recovery center. We have a couple providers who treat on these tables too. Okay. Not part of the recovery center, but then we can go outside over this. We're gonna go back to the cold outdoors. Here, we have a dry sauna. This one gets a lot hotter, so this is sitting at 194 degrees here. Okay. This one can comfortably seat 4. It does get a little bit crowded. This is also part of our expansion is that we're getting a bigger, hotter outdoor sauna.
And dry sauna means, how is that different than the other ones?
Not infrared. Okay. Yes, and then this one, people think that they can throw water on the rocks, but that might hurt our rocks. So we tell dry sauna, don't put water on the rocks. Okay. Very hot though.
Cool. Oh, so warm in here. So warm. Yeah, you can have another party in here.
Right?
Oh, this is nice.
This is a nice one, right?
Very cool.
Definitely the hottest one we have in here.
So you're a member here. Why do you like coming? You're clearly in the sauna.
Yeah, it's good to break up the week for a bit of recovery in between trainings. So, just a nice kind of break up from the normal routines.
What's your training? What are you training for? Any sports?
Half marathon at the moment. Okay. So, like trail stuff, and then Australian football is a league out here. So we're pretty recreational athletes, but still need to have a bit of a recovery dose throughout the week.
So what do you like to utilize here most?
Probably the sauna and then the hot cold, doing a bit of contrast, just to get a bit of a flush if you're a bit sore. It's a good break up from the workday as well, come in for a social chat, put up with these kind of blokes, but it's not too shabby.
All right, we got a salt water cold plunge, and tell me why salt water?
Salt water just has a little bit of an easier cleaning process too than chlorine, and some people don't love the chlorine on their skin, right? Okay. So this one's just a little nicer, a little less harsh chemicals. And it works really well with cold water.
I just want to touch the water. Yeah. Confirmed it is cold. The water is cold, confirmed. All right, salt water.
Right.
Like what sport do you guys play? Football. And what are we preparing for?
Pro day.
Yeah. Okay, so why are you coming to Denver for sports recovery?
It's the best in Denver.
All right.
Yeah, it has a little bit of everything. It has cold tub, hot tub, sauna. If you want cupping or scraping, anything like that. It has a lot of tools for us to use.
Yeah, for me, it's just a cold tub, hot tub. While I was in college, I did this every single day. Okay. And I feel like that's the way that my body feels so healthy and I feel just so great. And also with the cupping, they have the red light therapy. They just have the whole nine.
So how does this help improve your overall recovery performance?
Yeah, it really just speeds up everything, coming in every day with fresh legs now, so it's like, really helps.
Nice.
I don't know the science, but I know it makes me feel better.
There you go. That's what matters. You're feeling good, right?
Yeah.
All right, perfect. Well, thank you guys. Awesome. Okay.
Right, a nice little circuit. Okay. These are a bunch of add-on tools and a lot of really cool technology that we use. these are both class 4 lasers. This one's just an older version and this one's a newer version. Right, so same kind of red light therapy. Class 4 laser is just a very concentrated version, and class 4 is the strongest one that we have too.
Strongest what?
Strongest version of the red light therapy we have. Yep.
Got it.
So these ones, instead of like alternatively using like the full body light pod, these ones we're going to use for, you know, like an MCL tear, things like that, where it's like very
direct spots.
Yes, specifics, tiny spots that we're going to work on, rotator cuff tears, all that kind of stuff. Can be helpful for like basically any kind of soft tissue injury, right? So we'll use this a lot if someone is not necessarily immediately acute, but if there's like at least a week between them and an injury, we'll put this on there and just help some red light therapy to help everything heal a lot better in conjunction with all the other therapies we've had. It's been really helpful.
Okay, so red light therapy is proving to be something pretty beneficial.
It should be, yes, it should be the next best thing.
Should people, like, I mean, I've seen people that have like red lights in their homes now, like to get that exposure just every day. Is that like a recommended thing?
Yes.
Yeah, okay.
Yes, I think that would be awesome, especially red light before bed. Okay. Taking away some of the blue light, so nice.
All right.
Light pod before bed, ideal.
All right, good to know. And this one?
This one is shockwave therapy.
Shockwave therapy. I've heard of this too.
Yes, so this
Tell me more.
Also pretty, it's newer, but it's really, really helpful.
Okay.
So mostly helpful, what I've found with a lot of like chronic tendinopathies that we can't get a lot of things to release with.
What is a tendinopathy? We got to break it down.
Tendinopathy is basically any disease of the tendon, right? So like a tendinitis, tendinosis, any of that. Any inflammation or disease of the tendon is just under the umbrella of tendinopathy. Shockwave essentially is sends pulsed currents into the tendon, into the muscle, whatever we're trying to fix. And it kind of beats up the tissue a little bit, right? So I won't say this is comfortable. Like when we're doing it, we're asking the patient for like 0 to 10 pain scale feedback with it. So I mean, we're getting up to like 5, 6 out of 10. We don't want to push there, right? But then we're essentially, people have said it feels like a rubber band snapping on your skin, right? We're doing that to restart the healing process, right? So that we're putting in a good amount of inflammation to help it restart, to help things start out and get better afterwards.
Got it.
This guy, this is one of the more intense heads of it. There's a couple different attachments based on how far you want to get into the muscle. And then we use some like ultrasound gel on the tip of it. And then if it's like a lateral epicondyle, like a tennis elbow, you put it right in here, you would hear it go click, 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 click. And then basically it's measured on how many pulses we administer to the tissue. Right? So when you start out, we're doing a little bit lower ones. Make sure your tolerance is fine to it. It will make you pretty sore afterwards, so we do recommend like some downtime with it too. But then we can build up with it. And you typically do these sessions about once a week. You don't want to do it any sooner. Whereas laser you can do like as soon as every other day.
Got it.
Yeah.
Super cool.
Right? The Swiss Swing, our giant vibrating foam roller, takes out all the work of you rolling around on the ground. And essentially, it's just vibration therapy. People can dig into it, you can lean into it. It's pretty sturdy, it's not gonna move. So you can do it on a bunch of different body parts. You can sit down, get your lats, get your arms, or you can drape a leg over it, get your hamstrings and glutes. Feels really good.
Well, let's try. All right, how do we work this?
Okay, you can drape your leg right over it. This guy right here is the frequency, so the intensity of it there. Okay, we'll start you at the middle, and you can tap that button to turn it on.
It's quite the rumble.
It is. And you're not even at the highest.
I feel like I don't have to do much. This is great.
Right?
Like, I don't want to like roll around. Just like prop your leg up. Well, let's get both sides. Get that hammy in there.
Right, and this runs on a 2-minute timer, but people hang out here for 10 minutes at a time.
I like it. My hamstrings are sore. This feels good. I can drape my arm over it.
Yeah, and it is adjustable, so we can move it higher and lower too.
I'm not minding it at all. So can people come in and use this?
Yep, also part of the recovery center. Can be accessed.
Solid, I like that.
Yeah.
What is this room?
Here's where me as a physical therapist hangs out. We have a couple athletic trainers, and then Shin, our muscle activation technique specialist. Everyone who's involved in exercises, who's going to use a lot of these props, are all going to hang out in this room.
Okay.
So we got a nice squat rack.
All the things that I'm supposed to say.
My favorite part of this use is probably the cable attachments of it too. Anyone who lifts weights, it's nice to see them do the movement.
Yes.
And then here's 2 tables. This is my table here too. We have all the soft tissue tools in the back.
And it's literally any move if I'm doing
all the foam rollers you could ever want, right? So we have the tall, long ones here. We have the short ones down there. Some of the spikier ones down there as well. Forearm roll out there. All the weights, kettlebells, smaller weights this way as we have the bow flexes on the other side. Therabands, lacrosse balls.
All of it.
All the tools you could want. Yeah. And then the last part I'm going to talk about is just a traction table. So traction, it is what it sounds like. We have it for neck and low back attachments. All it's going to do, we're going to strap you in. One of our recovery center specialists is going to do it. This typically comes with a script from a chiropractor. So you see one of our team doctors before you do it, and we'll write the parameters down for it. It's just going to literally create some more space in your spine, right? So we use it with a little bit more like disc-degenerative stuff where there's just a lot of compression in the spine. This is going to allow either the neck to elongate a little bit more or the low back to elongate a little bit more. Helps take away some of those radicular symptoms, which is like pain going down the arm or leg.
Got it. Let's take a look.
Yeah.
So people just lay on there, strap in.
Okay, so this is blood flow restriction. So this is the Delphi unit, which is like the gold standard of VFR. VFR is used to essentially make exercises a lot harder without increasing the load on your muscles or your tendons. So it's really, really helpful for post-op, right? Especially when we have weight-bearing restrictions. We can make, you know, like a simple knee extension exercise really hard by adding this to it, right? Because it measures 100% of your blood flow occlusion, right? So where no blood can get through. We take all that off and then we add it up to 80%.
Okay.
So it basically is making all the exercise a lot harder because you're functioning with 80% of that blood. And then you decrease your lactic acid threshold. So you get that burn in your muscles a lot faster.
Gotcha,
right?
yeah.
And we do a lot more reps with this one. So we still get those same like hypertrophy, those still same strength gains with it.
Yeah.
Without as much load.
Yes.
Yeah.
So this is something that you typically use with a PT.
Exactly.
Yeah.
Yeah. So we usually do it in our session. If you have done it with us in our session, we can also teach some of the recovery center specialists how to do it, and you can do it as like a VFR add-on.
Okay.
Yes.
There you have it, guys. That was the full tour of Denver Sports Recovery. Thank you, Morgan, for showing us around.
Thanks for having me.
Yeah, for all the cool tools. So, guys, if you want to come check out Denver Sports Recovery, go to their website.
DenverSportsRecovery.com is going to have like all of our providers, all of our information. It should have all of our membership info too. If anything, there's so many options. So if anything you're confused on, just go ahead and give our front desk a call. They will happily take you through everything and think about your decision or your situation and get you what you need.
Yeah, there you go. So anyone from professionals to non-athletes at all can come utilize all these full recovery tools. They can even see a bunch of different providers. So many things you can do here. So come check out Denver Sports Recovery. Guys, if you liked the video, give it a thumbs up. Thank you so much for watching. If you've been here before, drop down in the comments and let me know what you thought, or if you want to come, let me know. Don't forget to subscribe to the channel, hit that notification bell so you don't miss any upcoming videos. But thank you guys so much for watching. Thank you so much, Morgan.
Thank you.
And thanks to Denver Sports Recovery. I will see you in the next one. Give it a thumbs up, warrior. Yes!